Hi everyone. For the next few minutes, I would like to present treating dry eye disease secondary to Meibomian gland dysfunction using plasma discharge. You can see here my financial disclosure. Jett Plasma Leaf Medical is a medical device plasma technology generator of plasma discharge, very compact, very light, and very versatile. With a pen specifically designed for ophthalmology. The plasma has 5 applicators, one golden applicator for ablative procedures, blepharoplasty, xanthelasma, entropion, ectropion, and also for severe Meibomian gland diffusion and blepharitis, and 4 silver applicators for the treatment of mild or moderate Meibomian gland diffusion and for periocular or facial rejuvenation. But how does it work? Jett Plasma Leaf Medical treatment uses plasma, the fourth state of matter, beyond solids, liquids, and gases, in which electrons separate from atoms to form an ionized gas that becomes highly charged, transforming into a continuous flow of plasma that stimulates the formation of new collagen and elastin fibers. Jett Plasma Leaf works with direct current and a high voltage, which guarantees a very accurate plasma flow. One device, 8 intensities and 5 applicators. The mechanism of action is not well understood, but potential mechanisms whereby Jett Plasma Leaf could achieve clinical improvement include thrombosis of abnormal blood vessels, heating and liquefying the meibum, activating fibroblasts and enhancing collagen synthesis, eradicating the modex, decreasing the bacterial load on the eyelids, modulating the secretion of anti-inflammatory molecules, reducing the turnover of skin epithelial cells, and decreasing the risk of physical obstruction of the Meibomian glands. When we are working with Jett Plasma Leaf Medical, I recommend silver applicator for treating patients unresponsive to previous medical management in mild and moderate Meibomian gland diffusion, working on the conjunctival surface, and the golden applicator only for plasma discharge to eliminate the hyperkeratinization membrane of the eyelid margin and severe cases of blepharitis and Meibomian gland diffusion. About Meibomian gland diffusion is the most common cause of dry eye, affect between 55 to 86% of all affected patients, and it is treatable in a very efficient way, since in severe cases inflammation of Meibomian gland degenerates in atrophy and disappearance of the glands. When we are working with a silver applicator for treating mild and moderate Meibomian gland diffusion, we only use anesthesia in drop, working with the silver tip 3 mm applicator, about the intensity starting with 3 and go up depending on the sensitivity of each patient, up to 8. The higher intensity used, the better result we will have. About 10 passes must be made on the surface to be treated. 4 sessions are recommended on every 7 days, every week. We have ongoing study using Jett Plasma Leaf Medical with plasma pen using silver applicator diameter 3 mm, intended for mild to moderate dry eye disease. OSD index before and after treatment is measured as an endpoint. About the procedure for treatment once a week and follow up 1 week, 4 weeks, and 12 weeks after the last treatment. You can see our initial result, 12 patients, 24 eyes. You can see the OSD index before treatment, after the second treatment, and 1 week after the last treatment. The results are very good. And about the pain, the most of our patients manifest no pain during the procedure. For conclusion, development of new treatment for dry eye disease, Jett plasma medical can contribute to achieving stability of the ocular surface in patients with Meibomian gland diffusion. In our results, 75% objective improvement with one or two sessions only. There were no side effects of adverse event occurred, and Jett plasma could be a new opportunity for treating mild and moderate cases of dry eye secondary to Meibomian gland diffusion, given the preliminary result obtained. And thank you for your attention.